I thought a little bit about this, and this is something we're about to publish, and I think it's important. This relates to variants of vascular anatomy. So we don't all follow the anatomy books and that includes our arterial anatomy below the knee. It might be interesting to know that the main artery behind the knee is the popliteal artery, and that in the embryo continues on down the calf to an artery called the peroneal artery, but then it gives off two branches that become the main branches to the foot. That's the anterior tibial and the posterior tibial artery. Now, it turns out that sometimes there are variations so that, for example, the posterior tibial artery may be absent congenitally high up in the calf, but then it's fed by this peroneal artery lower down. We call this posterior tibial continuation of the peroneal artery. The point being, you've got to be aware of these anatomic variants. And I had a case where clinicians had previously said this patient has a long posterior tibial artery occlusion and we can't get through it. And it's the main artery in the foot that we need to connect to. We could see it in the foot, but it looked occluded in the calf. And they had 2 or 3 attempts, both antegrade and retrograde, at getting this through, and they dissected and they weren't able to get through. And the patient was being considered for a transmetatarsal amputation. And I looked at the imaging and could see an anatomic feature at the level of the calf that I thought, you know what, I reckon this is actually the peroneal artery that is supplying this. And the peroneal artery had blockages as well. But we then did an approach through the peroneal artery, and sure enough, we could get into the foot. And really all this patient had was an anatomic variant that wasn't recognized. And our endovascular strategy was therefore changed. I would think these important variants are seen in about 10 to 15% of the population. And we haven't done as good a job as we could do at understanding and explaining that. That's why we're about to publish this, because it does come into clinical experience that recognizing these variants can really influence our strategy. So that was a really important lesson for me. And luckily enough, it had a really good result for that patient.